centers that have been providing treatment to high-risk COVID-19 patients here in San Diego are going to be closing up shop soon.
Yeah, CBS 8's Carrie Lane joins us now with where patients can get treatment if and when needed.
This is considered good news in the sense that we now have effective oral medication to treat COVID-19 patients that are considered high risk. These monoclonal antibody regional centers, also known as MARC centers, they were very helpful when we heavily relied on IV transfusions. But now, with the advancement in oral medications like Paxlovid, these centers will soon be a thing of the past.
We're at a good place right now with the current variants that we have. The treatments work very, very well to help prevent hospitalization and death.
Dr. Jennifer Tudor says we have come a long way since the start of the pandemic, and these MARC centers have been a huge part of that success, with treating just under 15,000 patients here in San Diego.
The monoclonal antibody regional centers have been a novel approach of collaborating with the federal government, the state government, and Emergency Medical Service Authority in order to bring to the front line with decreased barriers to care the monoclonal antibodies as they first came out, even before any oral treatments were available.
These MARC centers have allowed our local health sites to have the time needed to build up the necessary capacity to do what they do best, treat patients.
The state has heavily invested in a telehealth option where people can have a free telehealth visit, and that provider can talk to them, and if they're eligible, can prescribe them Paxlovid, which they can either then go pick up at the pharmacy, or it may be available to be delivered to where the patient is.
With the latest developments in COVID-19 treatments, oral medications are currently the most common prescribed therapeutic for high-risk patients.
The recommendation through the CDC is for people who are eligible to receive Paxlovid as the oral medication to do so.
Test sites will still remain open, and there are some that if you do test positive, you're symptomatic and eligible, you can get the treatment that you need right then and there. Also know during this transition, the MARC line will remain open. The number's there on your screen. If you have any questions, you can call 619-685-2500, or you can always dial 211. Coming to you from Claremont Mesa, I'm Carrie Lane, CBS 8.